The topic I'm introducing today is not only fundamental to the future of our continent, but also deeply personal to many of us. And this is about health and youth leadership in Africa. As we navigate the complex landscape of health in Africa, we are confronted with significant challenges, from the persistent burden of infectious diseases to the rising surge of non-communicable diseases and the systemic gap in our health infrastructure. Yet, amid these challenges lies an incredible opportunity for African youth to take the reign of leadership, driving innovative solutions and advocating for health equity and inclusion. Explore with me the intersection between health and youth leadership, and together let's envision an Africa which is healthier and more equitable for all Africans, an Africa where young people learn, lead, and impact. Overview, as I mentioned, of the African unique health landscape, which is characterized by a dual burden, as I mentioned, of infectious disease such as malaria, HIV, Ebola, Mpox, and just recently COVID-19, but also a rising prevalence of non-communicable diseases such as diabetes, and including in the mental health and climate issues, just to name a few. And we know that in Africa, many countries are actually struggling with inadequate health care system, including a shortage of healthcare professionals, but also very limited access to medical facilities and insufficient funding. These challenges, as I mentioned, result in a long wait time for patients, a reduced quality of care, and an increased out-of-pocket expenses for individuals seeking for treatment. And ultimately, it's delay progress toward achieving the universal healthcare coverage and exacerbating health disparity across the continent. Here is a reminder of the COVID-19. Remember that just very recently, the pandemic worsened existing health challenges, affecting health service delivery, but also highlighting vulnerability in public health systems. The COVID-19 pandemic not only stressed healthcare resources, but also disrupt routine health services, leading to increased mortality from preventable diseases and a significant drop in vaccination rate across many regions. And additionally, it exposed critical weaknesses in public health infrastructure, including inadequate testing, contact tracing capability, and a lack of preparedness for future health crises. Ultimately, it also underscored the need for a comprehensive reform and investment in health systems. We know that in Africa, 60 to 65, even 70% of the population is made of young people, those aged below 35 years. And their engagement in public health leadership is very critical in addressing health issues effectively. Youth-led solution can lead to innovative approaches in healthcare, leveraging on technology and social media. They can help to raise awareness, but also mobilize communities. So we need to acknowledge and highlight the success of and the potential in health that young people are making, and the difference that they're also bringing to inspire others to act, to take action in their community. We also discussed health equity and inclusion. We need to address disparity in health access, promote community engagement by promoting inclusive health policies that involve young people but also marginalized communities in decision-making processes by ensuring that their voices are also heard. And we also need to highlight the importance of culturally appropriate health intervention that respect local tradition and practices while promoting health equity. help us understand but also analyze the current health strategy in Africa that are critical for addressing public health challenges. And they're also critical to help us fostering resilience and ensuring equitable access to healthcare. On the continent, coordinated health framework are pivotal to help us build strong institutions, reducing health disparities, but also helping us in prepare for emerging disease threats. To conclude, I would like to share with everyone two things. First is a call to action. I encourage everyone present here to actively support youth leadership initiative in health and to advocate for policy that are ensuring that young people are meaningfully engaged but they're also actively participating in health decision-making processes. And by doing so, we are promoting health equity and strengthening healthcare system across Africa, but also we are creating a more inclusive and effective approach to addressing our continent's health challenges. Second and last point is my vision for the future. I would like us to imagine an Africa where young leaders are driving the development of sustainable health solutions on the continent. They're championing initiatives that are guaranteeing equitable access to healthcare for everyone on the continent. And in this vision, I would like to say that the energy and innovation of young people are transforming health system on the continent, but also they're making this system more inclusive and more responsive to the needs of all the community on the continent. So, ladies and gentlemen, dear all, my name is Promesse Kaniki. I work for the Africa CDC, where I serve as the Senior Technical Officer for Strategic Program, but also the Youth Division Lead in the Executive Office. I thank you all for your attention and once again welcoming you to this training program. Thank you.